So I'd like to have Safaa here with me. Please, Safaa, join me. She worked in the United States of America at the Houston Medical Center. She's, by the way, fluent in Swedish because she studied sustainability. Please come here. She's one of the co-founders of this virtual hospital. And she's now their strategy officer. Isn't it?
Yeah.
Or strategy director. Safaa, I was wondering, when did it start?
Thank you very much for having me. I came all the way from Riyadh, Saudi Arabia, to be with you here today. So thanks again for having me. It looks like I'm the last thing between you and the happy hour, probably. But I would probably assume that this room is full of avatars, adding to what we can see here. But it's already a full room, and I'm happy to have you all. To be honest, first of all, the whole story started during pandemic time. During that time, you know, there was actually it was a very hard time, and no one could basically access care properly or get their prescribed medications properly, and also it was a bit more limited for people to basically also to get exposed to virus and so on and so forth. So it was made this way to provide a convenient access to healthcare and professionals. So there was this model been born out of necessity, if you will, in the beginning.
So it was the COVID pandemic.
Exactly. That was the tipping point.
And when did you came in with your team to say, hey, we do it in another way?
Yeah, so basically even regulations been relaxed at that time. More, you know, they allowed for doctors to access platforms. It was a bit easier for people to be engaged on this platform, and we've activated this telemedicine across all regions, like where the video conferencing is happening. That was the initiation of it. It was called telemedicine platform. Then,
so the strict rule lessened.
Yes, exactly. And then after that, I believe maybe what I'm proud of, and there's definitely a big team behind this and a great vision of the country that supported to take this even further. So we leveraged on that experience, and we started this new concept, which is the virtual hub, a virtual hospital. This is all virtual. It's a B2B or provider-to-provider concept, if I may. Mm-hmm. And this is all connected to nearly 170 facilities across different regions.
Even the remote areas?
Yeah, mainly for suburb area, because all these peripheral areas are actually deprived from having access to good quality of care, to specialty of care. And you know, this is not unique to Saudi Arabia. I think this is a global challenge. You will never have enough specialty doctors to be accessed or to meet and serve the needs in different regions. And Saudi is huge. Like, Riyadh itself is like nearly 10 million people. That's just the capital city. So I believe we really need a new innovative model of care where we allow for more people to access care and enjoy health benefits.
And is it a private or is it a government initiative?
It's a government initiative. And, you know, Saudi Arabia is embarking a massive and significant transformation at the moment at all levels in every single sector, including healthcare. So with that being said, it's basically a mega transformation that's happening in every aspect of healthcare under the Vision Realization program. As we have an ambitious vision where we aim for thriving economy, vibrant society, better future of health, increased access to care, quality of service, and definitely cost-effective system.
So, but what do you do with the virtual hospital? Is it diagnosis? Is it also a preventive goal?
This is a very good question. So as I mentioned earlier, it's connected to 170 facilities across different regions. We covered nearly 73 specialties and subspecialties in different areas, including, for example, but not limited to rehabilitation, speech therapy, hematology, genetic medical disorders, psychiatry, pediatric, etc. And we provide also intensive care, like, like for example, the ICU, we have stroke services, we have the EEG, ICU where our specialty doctors are in the hub, and they're connected to those ER facilities and ICU facilities where they can basically do their rounds using special technology to basically keep them updated about their measures, their vitals, their medications, their admission situations, and they're all the time, they're guiding those doctors on the ground.
And for us, you say more than 100 facilities across Saudi Arabia.
Yes.
And who are there on the location?
Who in the location?
Yeah, are there doctors, nurses?
Yeah. That's a good question. So basically, sometimes in suburb area, you don't have enough specialty doctor, not enough consultants, sometimes not enough even specialties. You have the place, the space, the equipment, minimal capability possible, but they don't have access to a senior guide or to a full-fledged of integrated service. So for example, when we provide hematology services to those in suburb that they have techs and internal medicine doctor or specialist, but they lack probably certain capabilities, they can have that connection immediately with the system and get the guide needed. With the, for example, stroke, and this is a very good example that I always share. Our doctors, for example, they get notified when an emergency just, access certain facilities of those who are connected to this platform, and they can assess that and get direct access to their CT, brain CT, and they can basically give them the blood clot dissolving injection on the right time, saving them from further complications. And that was, just wonderful, to which extent telehealth can play a major role in saving lives.
And is there in Riyadh, for instance, the center who coordinates all these hubs?
Yes. So it is in Riyadh. There is a center of excellence in Riyadh, and there's this hub, which is the operational arm where we have all these doctors coming together. Some of them, or most of them, they're part-timers because they have other jobs in different facilities, so they're enjoying the hybrid practice, so we can get benefit of their time or extra time to serve other in needs in different regions. With the Center of Excellence role, under the umbrella of Ministry of Health, we played big role. Like earlier, maybe my question to WHO team, we work together hand in hand to support, for example, cross-border telehealth regulations, because in the hub in Riyadh, we supported the victims or survivors from the earthquake in Turkey that happened recently. It was quite sad episode at that time, but after that, I think the team, few of them were there with satellites and so on, and our doctors in Riyadh, and they were really helping so many cases with prescription, with imaging, with ultrasounds, and so on and so forth. Then there was like an eye-opener that we shouldn't just react using technologies and during crisis time, but rather how can we work together to basically support from a regulatory point of view where we can relax regulations a bit, where we allow to access technology, but not to jeopardize safety and security. So we need that balance. And we started to work on cross-border telehealth regulations, and we've done a great progress using virtual hub in Saudi Arabia as a use case.
So there's no limiting border lines anymore if you want to help Turkey again if there's an earthquake.
Exactly, and that was during a crisis. I would say we still need to do that quite often when in regular times, because not everyone is enjoying enough facilities or doctors or resources. Like, imagine a world that coming together, utilizing resources and help for a better future and better access to care.
So, but what about the acceptance of patients also in the remote area? I don't think that everybody in Saudi Arabia is that digitalized everywhere.
Yeah, I think digital literacy in Saudi Arabia is quite impressive, probably because the majority youth, like by population. However, like with this particular case I've just mentioned about stroke, this guy was an old man. He was very thankful and happy. Like we have him in a video, but I can't share it here. He was like sitting there and watching the consultant in Riyadh, reading his images and assuring him with the clinical team on ground, because he lives somewhere in the suburb area, and he felt very assured. And you can't imagine when the patient basically starts feeling that credibility or trust, because, oh, it's a big team, you know, someone from the capital city is there, he's the team of consultants, and it gives them that, you know, it gives that feeling of trust and credibility and assurance, and we've seen that happening, and people are adopting this quite good. And probably also one important key is when all entities work together under a mega project or under the government, because who's leading this change is basically the government at the moment, and I think this is very effective because all regulations, all programs, all support are moving towards this direction.
Shall we ask if the audience has questions for
Sure.
your virtual hospital? Yeah, I see already fingers. I will join you. I have to grab my... I saw a finger over here somewhere, isn't it? Yeah. Hello. Who are you? Please, can you stand up? It's easier for her to see you.
Hi, I'm Francine de Stoppelaar. I'm a former director at Cleveland Clinic. Really impressive. Thank you so much. I really enjoyed listening to that. I just have two questions. First of all...
Let's do the first question. That's easier for her.
Right,
yeah.
okay. First of all, obviously you're very focused on emergency care and on acute stroke and on post-disaster care, etc. of patients. But what about chronic patients? And are they not seeing their permanent doctors at all? Or how do patients respond to this? And it's very, very confident that you can, you know, it's great
Sure.
that they can have access to all these consultants, but
Sure.
only remotely.
Sure.
The chronic diseases or the not acute patients.
Yeah, sure. So CDM, or chronic disease management, is one of the vital programs under the umbrella of virtual hospital. So we do have home care services, and we do have, as well as the teleconsultation managing their disease throughout the year. So it's not just, we have the chronic and non-chronic, we have the intensive and urgent and non-urgent. It's like literally a hospital without beds and doors that include all the aspects of care. And this is probably what makes it unique.
And do you have also certain devices for the chronic diseases, which the
Yes.
telemedicine and so on?
Yes. So telemedicine, in collaboration, of course, with many partners who basically, we also, this is very good. We have what we call a regulatory digital health sandbox, been initiated recently. So this is to allow for all vendors, entrepreneurs, new technologies to be tested in a safe environment under the umbrella of Seha Virtual Hospital, where it takes probably 4 to 6 months to test in real life against certain criteria, which is cover different aspects like regulations, clinical, technical, etc. And then they get a certificate of completion and decide whether or not to be scalable or not. So it's more of a structured way of doing it to basically support bringing in more investors and bringing in more technologies and support this direction. And we basically identified many solutions that support CDM, or chronic disease management programs, and we're incorporating some of them already.
She has also a second question.
Please.
Thank you very much.
I hope that helped.
Yeah, that really helps, thank you. Your hub, is it just consultants, physicians, or are there therapists or pharmacists or clinical pharmacologists there as well to help with medications or specific directed therapies?
You mean the clinical team?
Yeah, the clinical team in the hub that works remotely.
They vary. Like we have consultants, specialists, GPs, and nurses. Is that what you mean?
Yes.
Yeah. So it's a combination. Yeah, multidisciplinary.
And I saw that you do also remote, because I saw more videos about the hospital. But it was they were too lengthy a little bit. But you do also surgery with remote advice, isn't it?
Exactly, because tertiary is very crucial as well. Because, for example, with this, you have neurologists, you have consultants, but probably we have, let's say, 50, 60, 70 stroke consultants across the kingdom. How can we get the best out of them? How can we build that platform where we create a pool of talents that can be accessed from different regions and utilize them better and get guidance when it's needed and build that integrated care as much as we can? It's an evolving process, but I think we're getting there as we move, because B2B or the specialty care or the tertiary care is also important, specifically when it comes to peripheral areas and suburb area. They don't have consultants, they don't have enough ICU doctors. They have some clinical team, but probably they still need a guide to set basically for their treatment journey.
And also that their skills.
Exactly, to support admission and readmission. One of the services, for instance, we have, like they call it the telecommittee, which is like one for the heart disease, one for tumor, one for psychiatry. We're all like very, very well educated and top-notch experts actually sitting together, reviewing cases from different regions across the country.
Wonderful.
And decide for
Let's
their
see if there's
admissions and
another
so on.
question, Safaa.
Please.
Because we are running
She
out of
scared
time.
me.
Oh, no. I'm not.
You're intriguing me, Frans Wakers from the MNC. You're intriguing me because I'm a radiologist, and you say you're doing stroke. And I think, I'm not an interventional radiologist, but we do a lot of thrombectomies in our department. And how do you do a thrombectomy remote in a stroke patient?
Yeah. So basically, this hub is connected to ER rooms, and they do a lot of training on grounds in the beginning to act like, for example, to activate code blue and so on, and teach the people how they, when this patient is actually accessed, starting from calling the patient, or the patient, sorry, calling the ER, all the way until they reach, we call it door to needle. From that door, when they access ER until they get the injection by the hub inside the hospital, it takes 25 minutes only. So the way they do it, by connecting themselves, using technology, of course, with ER rooms, and they can, the moment they get that notification, they jump on the screen and they see the image of the brain, and they basically have access to the room. They see they have also that machine where you can see the pupils of the eye, like the dilation and so on.
She has a video with her. So after this
I
session,
can share with you probably more.
She can share it. It's quite impressive. Safaa, thank you so much for joining us. It's already time.
Thank you. Thank you very much.
Thank you, please.